Fellowship education includes structured didactic training, but more importantly, it requires mentorship. It's not optional. It is not vague. It is mandatory. So fellows must engage in supervised, real-time clinical training, and often involving dozens or hundreds of patient cases with expert feedback. That's how clinical mastery is built. That's how we protect patients. And that's how we elevate the physical therapy profession. So when a company offers a fellowship made up of 4 or 5 two-day courses with zero mentorship, zero feedback, and zero reporting oversight, well, that is not a fellowship. It is a shortcut, and shortcuts in healthcare lead to mistakes. So, what are the dangers of fake fellowships? Let's talk about what is at stake here. These programs graduate people who have not had a single supervised scan reviewed. They haven't been mentored in identifying pathology. They've never received corrections on how they write ultrasound reports. And yet they walk out with a fellowship title. The result: misdiagnosed tendinopathies, missed tears, false positives that send patients to unnecessary orthopedic consultations or even to surgeries, unnecessary surgeries. This isn't just clinically irresponsible. It is a liability. It puts the patient at risk, it puts the provider at legal risk, and it puts the physical therapy profession under scrutiny. These low-quality programs harm us all. They dilute the value of real training. They create confusion in the marketplace, and they give ammunition to those who argue that PTs should not be doing diagnostics at all. Well, on the other hand, let's see what makes a real musculoskeletal ultrasound fellowship. Let's talk about what real education looks like. At the American Academy of Musculoskeletal Ultrasound, AAMU, we've built a program that's aligned with ABPTRFE standards. Yes, we teach the courses, classroom courses, online courses. Yes, we give you tools like our proprietary Sonoscript app to make reporting easier. But we also do the hard work. We pair every single fellow with a board-certified mentor. You don't just passively absorb in a classroom setting. You actively scan. You write ultrasound reports, and most importantly, you get 150 of those reports reviewed by a board-certified mentor. They get corrected, they get improved, they get sharpened. That's how you build real clinical skill. You learn to accurately identify structures. You learn how to accurately recognize pathology and how to communicate your findings clearly in an accurate diagnostic report. Not only does this protect patients, it makes you more valuable in your practice. It increases your reimbursement, and it makes your practice stand out as a place where diagnostic excellence lives.